This one, the 18th Summer Conference, taking place for obvious reasons online. But it's those same obvious reasons which have renewed our interest in science and health reporting, which you heard about in the last talk, and which have also brought us to the work of Katherine Eban, a reporter whose work has taken her from the New York Times to ABC News to, more recently, Vanity Fair. Katherine combines investigative doggedness with a rare ability to write, usually at length, in long articles and in several books. And I think I'm right in saying that her investigative obsession, and everyone needs one, is the pharmaceutical industry and its relationship with government and with regulators, and the malfeasance and corruption which sometimes results. It's a relationship which she explored in her book, Bottle of Lies, which is a book about the boom in generic drugs, which took a decade to investigate, and which she's drawn upon more recently to examine pharmaceutical drugs and our relationship, or our attempts to overcome COVID-19. So first of all, Katherine, welcome.
Thank you. Thanks for having me. Great to join you.
It's an honor to have you. And you very kindly agreed to present some slides, first of all, to shed some light on your reporting methods and your work on documents. So I'll leave the floor, or in this case, the screen, to you for about 20 minutes or so while you talk about what you do, and then I'll ask you some questions, and then I'll hand over to the audience. Just a quick housekeeping point before you do. If you want to ask Katherine a question, can you put those questions in the Q&A section and not the chat section? And I'll chair, and then I'll pass some of those questions across in due course to Katherine. So Katherine, off you go.
Okay, thank you. And thank you, James and Juliet and CIJ for having me. It's a pleasure to join everybody today. Thanks for taking time to be with us. So I'm going to share my screen here. Okay, so I think we're good. You can see my screen?
Yes.
Okay, so I'm going to just sort of talk to you quite personally today about my reporting journey in the middle of COVID-19 and just share some of my methods and techniques that I have used to be able to connect with sources and get documents. So I had, as James had mentioned, I had spent a decade reporting Bottle of Lies, which is an expose of the generic drug industry, which is, narrated, it's narrative nonfiction with characters, all that. Anyway, I emerged from that book and was essentially in the middle of my book tour when COVID-19 hit. And so it's really, at this point, for journalists, it's about the most important story in the entire world. So I knew I wasn't going to sit this one out. So I jumped in and, after a decade of just working on this book, what struck me immediately, of course, is that the news cycle is just moving so fast. It's incredible to me. I mean, if you can get exclusive information at 9 a.m., you've lost it by 5 p.m. So that was, one of the issues. The other issue that I noticed right away is that, a lot of the media, I mean, everybody's on this story. So you're essentially competing against thousands of journalists. And, in any given country, you are competing for a certain limited set of sources who have real information. And my mandate from Vanity Fair is to report on the federal government's response to the pandemic, which, needless to say, has been catastrophic. So my question was, how in the middle of this can I develop sources, get exclusive information, and break out stories when everybody is on this? Let's see, hold on, if I can. Is this letting me advance? No, I am not. Okay, there we go. Okay. So one of the things that people have asked me is, what are the tools that you are using to report? And what I wanted to share is that I'm actually using very old-fashioned tools. Here is my giant Rolodex from 20 years ago, which I dusted off and got out. Because what I am looking for is human sources. And I want to contact those sources by cell phone or on encrypted platforms. So, it seemed very obvious to me that if you're going after government employees and you're contacting them on their official government emails, you're not going to get anywhere. They're not going to want to talk to you. So I have found very basically that mobile phone numbers, as basic as that is, are the coin of the realm. Basically, once you have a mobile phone number, you can put that into Signal. You can put that into WhatsApp. You can see if they're there, right? And then you can reach them that way, even if you can't find a personal email. But another thing that I did, and I will say, while my book helped me with sources, it's slightly different. I mean, the pharma guys are different than the infectious disease guys and gals. So one of the things I did immediately is try to figure out, who do I know in the public health world who can make introductions for me, right? I mean, all of these government employees are just, they're on Zoom calls all day long. Their email inboxes are overflowing. And if you're just sticking your hand up out of the blue to ask them to talk to you, it's not going to work very well. So I went back to figure out, who do I know? Where are they? And what I began looking for is former employees of the government agencies I was reporting on. Because as part of a handoff process, the former employees know the current employees and usually have their mobile numbers. So I went back to this 20-year-old Rolodex, which my husband calls my horse and buggy, and basically started looking at who's where did they used to be, right? And who do they now know there? And who can they introduce me to? So as part of this, I found it is really important. If you're looking, there's signal and there's noise, right? And you're trying to figure out, at least, or one of the things I was doing is, what is abnormal here? How is the system supposed to work? And what kind of rules are being bent? What safeguards are being circumvented? In what way is politics clashing with science, essentially? So one thing you need to learn in order to figure out what the deviations are, you need to know how these bureaucracies work, right? I mean, every government response is happening within a giant bureaucracy, right? No matter what country you're reporting from. What are the agencies, and what are the rules governing those agencies, and how is this supposed to work, right? So I have spent a lot of time just studying organizational charts. How does the information flow through these agencies? What is the organizational tree? Then I would take these org charts and, using a very old-fashioned pen, I'd print out the org charts, write in the former employees in all the positions and the current employees, and target those former employees as a way to get into these systems. I mean, it's very painstaking, but as I've found, if you are not lying awake at night trying to visualize these bureaucracies and trying to figure out how the information flows, you are not really working the story. At least that's my impression. I mean, you've got to be obsessed with the minutia of how government works in order to carve out information. And I'm going to talk about some of the stories that I did where those principles were relevant. You know, another thing about former employees, you might think to yourself, well, they're not in government right now, so they can't be helpful. But they have a little more free time, and they can explain how the system is supposed to work. You have to know how the system is supposed to work to understand how it may be failing to work, right? I mean, how is a response supposed to go? So let's take a look at that. So here are a couple of stories. Let me go back. Whoops, hold on. Let me go back. Sorry. Okay, hold on. Just one moment. Hold on.
No worries.
Okay, let's try this again. Okay, thank you. So we're back online here. Okay. Here are a couple of stories that I did. When I before I was under contract at Vanity Fair, I started reporting for Reuters. In this case, my sources from Bottle of Lies, my book, was useful. So what I found out, Donald Trump got up at the White House podium on March 19th and announced that there was this game-changer drug, hydroxychloroquine. But what I found out is that the FDA had decided to permit, they passed a special emergency rule, which was going to allow the FDA to import donated hydroxychloroquine from a plant in Pakistan that they had never inspected before. This was really seismic in the world of the FDA, in the arcana of the FDA. Every plant that gets permission to import drugs into the US has been inspected. So this was like a giant deviation. So that was a story. Well, so I was on deadline for this story. How was I going to learn about what the story was for this plant in Pakistan? So I'm trying to think, who do I know in Pakistan? And this is where I've spent a lot of time doing research inside my own LinkedIn account and my own Twitter account, researching my own followers to see who might have information. So I remembered there had been a guy in Pakistan who had written me a very positive note about my book. So I just wrote to him and said, hi, I'm researching this. Well, it turned out he had been the inspector in Pakistan, a Pakistani regulator who had gone into this very plant and because of a whistleblower, and had discovered 4 years ago that it had made subpotent hydroxychloroquine. And within 5 minutes, boom, I had all the records. He sent them to me. So, you know, that's an example of really, you know, starting with first principles, which is your own inbox, your own Rolodex, your own contacts, and trying to build it out from there. Because in this hurricane environment, it's extremely difficult to create new sources out of thin air. You know, I mean, I think there's an expression, a pandemic is a very bad time to exchange business cards, right? So how are you going to cut through all of this to make these connections? So I really went back to first principles. Then you have to figure out who are the people inside these bureaucracies who might object to deviations from standards. You really have to think a lot about that. You know, it's not the political appointees who are posted in these agencies. It's the lifers who have been there for 25 years and know how things are supposed to go. So it was basically thinking along those lines that I managed to get through to someone who was upset about these deviations and who was, you know, copied on these email chains. And basically from that reporting, I was able to cultivate, I was able to get emails. And the emails basically said, these drugs are dangerous and we have to be careful. That's a big story. You know, that's a big story. Getting those emails made it pretty irrefutable. One word about, you know, getting those, how do you cultivate, if you're trying to cultivate news sources in this environment? One thing that I've started doing is people who I want to have a relationship with as sources, I've started pretending that I have a relationship with them. So I start emailing them. I introduce myself. One of the things that I do is I don't just ask for information, I offer information. That's been very useful because a lot of these bureaucrats are very siloed. They don't know what's going on to the right or the left of them, and they want to know. So if you're somebody who, as opposed to just asking for information, is giving them information, it changes the dynamic. And it also lowers their sense of risk in talking to you, right? Because if you come across as somebody who has to be educated from the ground up, as though you don't have any other sources, if they're your only source, that's a very high risk. But if they feel that they are one of many sources, it changes the calculation about whether they're going to talk to you. And so offering information shows them that you are getting information from other people, gives them a sense of comfort. So, you know, I've had situations where I've, over the course of 3 weeks, sent somebody 10 emails every couple of days. Hey, I've learned this. Hey, I've learned that. I mean, if you were trying to date somebody like that, you know, you'd be a stalker, basically. But, you know, I'm trying to create a sense of relationship, and then lo and behold, maybe on that 10th email, that person will email me back. So it's just, you know, keeping on building, building, building. And through that, I managed to get internal emails from pretty much the top public health experts who were dealing with the White House, who said, we want to flood New York and New Jersey with hydroxychloroquine. That was by far my biggest story. I mean, it was really a huge story, which was it revealed their, you know, master plan for this unproven drug. But I basically got to that point by using these techniques that we've been talking about. So let me talk a little more about converting skeptical sources. And are we good on time, James?
We're perfect on time. This is exactly what we want.
Okay, great. So first of all, I am, just as an example, and not to be critical of any colleagues, but I recently got an email from a journalist who'd heard me present at a journalism conference, who wanted a little help with a story, and kind of dashed off an email to me saying, hey, did such and such a person have any information about X? And in that email, she got the name of the person wrong. It was misspelled. And I found that note kind of both shocking and emblematic, which is everybody's moving so quickly. But let me tell you, if you're seeking information and you do not take the time to do your homework and write a very carefully crafted note to somebody you're trying to get to talk, why should they respond to you? You've given them no reason to talk to you. All you've demonstrated is that you're a journalist who doesn't do their homework. You've also probably increased a sense that you'd be a risky person to talk to. So these emails or WhatsApp messages or however you're approaching someone, they're critical. They're critical. I will spend a lot of time researching somebody's background before I send one of those notes. I am trying to demonstrate that I do my homework, that I'm committed to accuracy, that I'm careful, that I care about the information I'm trying to get, right? So with that first approach, when I do it that way, I've increased my odds of success in a very competitive environment, right? And I mean, this environment is so competitive. So if you think a source with information might have been contacted by 15 other journalists, who are they going to talk to? The person who dashed off a note or the person who did careful research? So that's like number one critical thing. Another thing is to absolutely demonstrate your commitment to the story. So I'll give an example of this from my reporting on Bottle of Lies. I've been trying to get somebody to talk to me, and through an intermediary, that person basically agreed, but they only wanted to do a meeting in person, and I was in New York and they were in Beijing. I'm like, all right, I'm going to Beijing to just chat with this person. I mean, on the one hand, it seems absolutely nuts, right? But on the other hand, it's a demonstration of commitment to the story. So obviously we can't just hop on a plane to Beijing right now, and it would be very unwise in the middle of a pandemic. But one of the things you have to do is demonstrate the lengths that you are willing to go to nail a story, because that is what is going to distinguish you from every other journalist out there. And it's also, I sort of think of it, it's a loyalty test, right? You're demonstrating your loyalty. A lot of the hurdles are opportunities when you understand that by overcoming them, you are demonstrating your commitment. So another thing is that you might think to yourself, that person is never going to talk to me, right? Never, ever. So it's not even worth the phone call. It's not even worth the email. It's always worth the email. And in fact, some of my best sources are the people who I started out investigating. You know, they want attention too. So you never know where your information is going to come from. I built a whole story which was basically cultivating someone who I had started investigating, who ended up sending me text messages. So, you know, screenshot text messages that I built a whole story out of. So never make assumptions about kind of where loyalties lie in these bureaucracies, even though it might look like everybody's on the same team. You know, if there's 100 people in a bureaucracy, there's 100 teams, basically. So that's very important. And then I'd want to sort of show you for the book, I began cultivating a source who had information from inside of the FDA. And that person wrote back to me and said, I'm not convinced the story should be told. I don't understand its purpose. I'm not convinced you're the person who is ready to tell this story. You haven't demonstrated your knowledge to me. That is what I would call an opportunity. They're holding up a hoop and seeing if you're going to jump through it. It's an invitation to demonstrate your knowledge and your commitment. And I should say that even if somebody is saying, I'm sorry, I'm declining to comment, that's a conversation. That is a lot stronger place to be than somebody who doesn't respond. I mean, so long as they have not said, if you contact me again, I'm going to call the police, there's a relationship there. So you keep going until they invoke, law enforcement, basically. Even if they're saying no, you keep going. That's what I've done. So from this starting point, 3 months after that starting point, that source gave me a thumb drive with 20,000 internal FDA documents in it. Okay, so that's what the kind of, hurdle can open up for you if you use it right. Let's see. Hold on. Let me. Okay, so here's just a couple of points about tracking medicine. When you think about information and how information flows, I think what you want to think about is tributaries. If you live near water, if you live near a beach, go and just see how the water comes in and how it moves across the sand. That's what you want to think of. So where does the information flow? And it is very, very useful, I think, to map a landscape. I mean, I think of stories as landscapes. And I don't know if you've had this experience, but you're in a landscape you've never been in before, and everything looks unfamiliar, and you don't know the trees, and you don't know the paths, and basically what you want to do is you want to learn that landscape. So how does the information flow? So let's just think about medicine. Doctors, medical societies, patient advocacy groups, plaintiff lawyers, legal records, government records, websites for official bureaucracies. If you're reporting on a bureaucracy, find out what kind of documents did they issue? What kind of inspection records? What are the forms? What are the names? Because part of this is becoming fluent in a language. These are all languages, and when you talk to sources, you want to be speaking fluently. You want to be the reporter who knows all these languages. They'll be more likely to talk to you if you can speak the jargon. So you have to learn the jargon. You absolutely have to. The oversight bodies in the US, Congress, inspectors general, Department of Justice, when we used to have a Department of Justice. We still do, but it doesn't do much by the way of oversight. Equipment makers, software makers, who's CC'd, who's on the email chains. You've got to think about this. I mean, even when I've gotten, like recently, someone shared with me a bunch of very heavily redacted documents where almost the entire text of the documents is redacted. So what use are those? Oh, they're so useful, because so long as you can see who's sending the email and who's receiving the email, then you can see who's talking to each other. That's super useful, because that helps you see how the information flows. So LinkedIn, incredible reporting tool for former employees, current employees, who follows who. These are very, very useful. Your own LinkedIn followers to contact people. YouTube, technical videos. When I was reporting my book, my question was, well, how do you make a generic drug? How do you do that? Oh, okay, let's go to YouTube and watch really boring expert videos on the making of a generic drug. So how-to videos, super useful. You can, there are all kinds of videos about, N95 masks and, that's an ultimate source. Then you want to think about online water coolers. Employees, where do they talk to each other? Where are they hooking up? Where are they comparing notes about companies? So for pharmaceuticals, it's Cafe Pharma, but every industry has a water cooler. You can also post stuff. You can invite people to come and talk to you. So you want that. Financial records. Those are wonderful. SEC records, investor documents, where they're required to disclose risks, and sometimes they disclose investigations. Super useful. Another way to go is white knights, compliant companies, industry leaders, people who have been trying to make things work right and they're not working right. So those are kind of, all the places you have to think of, sometimes when you're not reporting well, it's like in chess, right? You should have 10 possible moves. And if you only have one move, then you're not reporting it right, because you're not thinking about the landscape. You're not thinking about all the tributaries. So that is, critically important to do. So that's really, that's kind of a background on how I think about reporting a story.
So that was a fantastic masterclass in investigative method, Katherine. Thanks so much. Also instructive in terms of thinking about the distinction between trying to secure a date and trying to secure an investigative interview.
Yeah.
I remember our mutual friend, Mark Lee Hunter, once telling me, also a CIJ trainer, that the distinction between a ordinary newsroom interview and an investigative interview is that a newsroom person phones up, asks for a quote. An investigative interviewer phones up and offers something, all the better to draw someone into a conversation in which they might want to participate as a source, which I also heard from your presentation. Anyway, thank you very much for all of that. I thought I might just ask a couple of questions, moving the conversation on towards COVID. I know that when we spoke yesterday, you mentioned your interest in, or the importance of understanding audiences and thinking about cultural biases and what stories will fly. And I know that you were fascinated by the Dominic Cummings rule-breaking story and how that might have played out differently elsewhere. Maybe you could talk a little bit about that.
Yeah, well, I just sort of hung on every word of that story, and I thought that the British press did an amazing, I was fascinated in how they sort of cornered him and forced him into that garden press conference that he gave, which I watched with fascination. But I thought to myself, this story is very particularly British, because the British, and forgive me if I've really got this bollocksed up, but it strikes me that, I lived for 3 years in England. Rules are a really big deal in England, and people tend to follow them. And we're living through a time right now in the US where the people in power have smashed every single rule. And so I think if you took the same story and you put it in the US, people would not be so shocked at his conduct because it's what we've come to expect. But the way in which the British press understood the cultural norms and how those norms were violated, right? So that's really what you're looking for in this reporting, is what are the norms and what are the violations of the norms? And I would say I've been doing that kind of reporting in terms of looking at more like the regulatory norms and how the political process and what's being dictated from the White House has smashed those norms to smithereens. But I think, the point here is to be, to come at this with sort of cultural sensitivity, to understand where the stories lie. And so that just struck me as a very particularly British story. I thought it was fabulous.
Absolutely. Let's talk about the relationship between politics and science then. So after President Trump's endorsement of hydroxychloroquine, that changed things. And it was your thesis, I think, that there was may have been a resulting drop in standards when it came to the FDA's approach to the drug in all kinds of ways. I think you've covered that a little bit, but maybe you could say a little bit more about that.
Yeah. So, I have found in this pandemic that my sources, what's happening is Trump is going to the podium and he's announcing some bright, shiny object. So hydroxychloroquine was one of these bright, shiny objects. totally unproven, potentially dangerous, but he declared it to be a game changer from the podium. So then what was happening is this massive political pressure was moving down into the agencies to make his proclamations, to bring them to life, right? So it's like, oh, okay, he has proclaimed that this is the game changer. So suddenly we have to stockpile this stuff from all over the world. So suddenly this big team at FDA was tasked with finding hydroxychloroquine under every bush and tree in the whole world, which led them to this terrible, dodgy plant in Pakistan where they were going to get 1 million doses. This is a plant in Pakistan. No US regulator had ever set foot in it. And it was so bad that even the Pakistani regulators thought it wasn't good. That's a hell of a story, but what you're basically doing is you're mapping the way in which those proclamations from the top are getting absorbed into the system down below. So that's all about watching, mapping the tributaries from the White House podium down through the agencies and how directives move through the system, right? And that is what I've figured out is sort of my job, is to figure out how that moves through the system. So that, that is what I did with hydroxychloroquine, and it basically uncovered this giant battle inside of the administration over this drug. That yielded me like 5 or 6 stories.
So please do, if you have any questions to ask anyone in the audience, put them in the Q&A section so that I don't monopolize the conversation. But in the meantime, another question on politics and science, which is that last week, The Guardian reported that the US had bought up or tried to buy up stocks for the next 3 months of this drug remdesivir, which I might be pronouncing wrong, the trial drug used to treat COVID-19. What do you make of that then in terms of equity and economics?
Well, that is, that the issue of equity and economics in all of this is a very, very big story in the middle of this pandemic, which is you've got essentially a limited source of materials, right? Whether it's PPE or ventilators or drugs. And so the question is, who owns that? Who makes that? How is it distributed? And basically in each case, you want to see, what are the governmental claims being made about distribution and what's the reality of the distribution? It has been just something that would seem to be straightforward, like, how is medicine distributed? How does medicine wind up in the Strategic National Stockpile, and who distributes it from the stockpile? How does it get to the states? I mean, these are all very, very complicated reporting questions that are anything but self-evident. So again, it's a landscape with a lot of different roads, and you need to figure out how goods and materials flow, and how they're actually flowing deviates from the official claims, of the government. And the claims are usually, Trump, anyone who wants a test can get a test. Well, that's a total lie, right? So it's sort of parsing all of this stuff.
Gotcha. There's a couple of questions here. Let me see what is good. Someone is puzzled by the lack of response from US senior medical officers who shared the podium when Trump suggested the use of hydroxychloroquine. Can you comment upon that?
Yeah. So it's my sense of it is it's a very, very difficult dynamic in the US right now, which is these scientific experts are are terrified of being kicked off the podium. Because they're sort of one tweet away from being muzzled at any given moment. And so there has been a sort of, they've sort of alternately held their fire and spoken out. And that is the sort of delicate balance that they are walking, because at any given moment, the White House could just pull them from the podium. And I think my sense of it is that as the death rate goes up, the frustration levels are rising. So I think from a reporting point of view, you need to kind of intuit the mood of the people you're trying to reach.
Gotcha. Someone called Tom has asked about, have you worked with data specialists in your reporting, and how did you find that relationship? Did you work with any data hounds?
Yeah, not during my COVID reporting. I did somewhat during my Bottle of Lies reporting. But really, I think my approach in my COVID-19 reporting has not been data-driven or high-tech in any way. It has really been human sources and documents is what I am aiming for. And I, when I get a document, I mean, I've really had these experiences of right now I have, for example, an invoice on my desk. It'll probably be featured in my next story, so I won't go into too much detail about, who it's from and to. But I have spent hours looking at this invoice, trying to report out every possible piece of it, because every little bit of information is attached to another piece of information. And so really that's been my approach, not so much data.
Gotcha. Someone else has asked about your story about Trump's rally in Tulsa.
Oh yeah.
So did that contribute to a greater spread of COVID-19 in the area? Do you think the numbers fiasco in Tulsa contributed to the cancellation of subsequent Trump rallies?
Yeah. So, that was an unmitigated disaster for the president and for, the kind of trying to create the illusion that somehow this virus is, diminishing. He can get back to business as usual. But it is now clear, the Tulsa health officials have come out and basically said that they connect hundreds of cases to that rally. And I think that it has actually kind of slowed the White House's effort to get him back on the campaign trail. Yeah.
Let's talk a little bit about pivot from COVID-19 to your own career. And I know you mentioned when we talked on the phone yesterday that you'd spent 10 years deeply immersed, sort of underwater with Bottle of Lies, and then you rose to the surface quite fortuitously, as it happens, throughout COVID-19. What's it like then to make that transition between a time when you weren't at all really seeking bylines to a time when you're probably obsessed by them?
Yeah. So, first of all, to do this deep dive on Bottle of Lies, and I think in that time I might have had over 10 years, 6 or 7 bylines. And I just made a decision to not worry about it. I've pretty much always in my career made a decision to just follow the story. I've never followed the job. I've never followed the byline. I know there are really successful journalists who have taken a different approach, but that's been my approach. And it has worked out for me. Even in my sort of darkest hours, I've always felt that the story is the North Star. And so I have, I just tracked Bottle of Lies to its logical conclusion. So then to emerge from that and pivot into this frenzy, this absolute journalistic frenzy, and these, supersonic news cycles, it's just super challenging. You got to just work 12 hours a day. Otherwise, you've got nothing, you know. And you do have to think, you have to think defensively as far as guarding your scoops. If you go too early to ask people for comment before your story's locked down, and they'd maybe rather have your story out in a more favorable news outlet, and you're going to get scooped, right? Stuff's going to leak. So, there's a lot of sort of strategic thinking about how you report and how you approach things. But to me, that's why internal documents are so critical, because that's your advantage. If you have that, and if you have exclusive documents, you're way ahead. So that's what I've, in every story, that's what I'm angling for.
A good example, perhaps, of following a story, and maybe it tells us something about the value of science and health reporting too, is how you came to write the story about enhanced interrogation technique, which led to the film, The Report. And if I'm right, you didn't come to that by wanting to understand torture. You came to that by wanting to understand psychology and the role of the American psychology profession. Maybe you could tell us a little bit how you found your way into a deeply political story about science.
Yeah, so I was approached, actually, it was not unconnected to torture, but I was approached by a group of psychologists who were members of the American Psychological Association. So that is the main group representing psychologists in the US. And something very strange had happened inside of the APA, which is, and this was during the War on Terror, other medical organizations like the AMA, the American Medical Association, which is doctors, had passed professional guidance saying, because your professional oath is to do no harm, we feel that our members should not be participating in coercive interrogations, essentially torture. But they had sort of pulled their professional members from participating. But the APA alone, among all medical groups, had permitted their members to participate so long as there was no lasting harm done. So why had this happened? And I began reporting on the APA, and their question to me was, had something irregular happened in these deliberations inside of the APA? And they came with hundreds of pages of minutes of meetings and all of this. And it took me 9 months to unravel, but basically nothing irregular had happened in those meetings, but there were two psychologists off in the wings named Mitchell and Jessen, who were not even APA members, but they had been recruited essentially by the CIA as consultants. And they sort of became the architects of these coercive techniques that were being used. The blasting music, the dogs, the walling, which is the slaps against the wall. And so the psychologist, the organization was sort of giving cover to these guys who had nothing to do with the deliberations inside of the APA. And by reporting on that, I had uncovered this whole hidden architecture of these two guys. And I remember the moment where it just been trying, so again, it's like these tributaries, where is their information? And I learned that one of these psychologists was a consultant. I thought, that's interesting. I want to look at business records and see if he's established any corporations. So I remember to this day, the moment when I got into the North Carolina business records and found that he had established this sort of creepy consultancy called something like, mind wizard or something like that. But he had submitted a note to the North Carolina Business Registry saying, you know, as of this date, the members of this corporation will be out of the country and we're sort of suspending our business operations. So that was one day after Abu Zubaydah had been captured and an interrogation had begun in Thailand, which he flew to Thailand. I found out he flew to Thailand and participated. But that leads me actually to a point I did not bring up, which is a critical point. Every complicated story, you have to have a timeline. You have to build out a timeline. I do it for every single story I write that is at all complicated. Because it's one thing to have an entry in a set of business records saying we're suspending it, but whoa, once you find out it happened a day after Zubaydah was captured, that's different. That's different. And you wouldn't know that unless you were building a timeline.
Yes.
That's critical.
That brings me to another question listed here, which is in terms of method, how do you organize all the documents, sources, and links between people while you work in your investigations? Is it all in your head? Do you use a master file, build a database?
I build a database. I mean, I know I said I wasn't using databases, but I have an Excel spreadsheet for any complicated story, which is like dates, people, events, notes, where I found the information. And that way, both you're keeping track of information and you can overlay it better. So it's a kind of three-dimensional, you know, it's a scaffolding. So I build that scaffolding and I build a timeline for any complicated story.
Gotcha.
I will actually add one more thing, which is a timeline is a great way to have a conversation with your editor, because you can send them the timeline and you're like, this is what I've got. So as far as, you know, managing your own editor, which of course you have to do as a journalist, that's helpful.
Gotcha. Maybe one last question, which is sort of stems from the stuff about psychology to some extent, which is how you get ahead in investigative journalism by acquiring expertise in a specialist subject. Now, as we know from the last talk that we did, science and public health journalists find themselves fortuitously on the sexiest beast around, or the sexiest beat, sorry. But how do you get a start then in science and public health? You took an MPhil in English literature at Oxford and specializing in 17th century literature, as far as I understand. So can I ask how you segued from that to big pharma?
Completely by accident. But I will say, I'll tell the story, but just say that, you know, in journalism, go back to first principles and use what you know. So I was at Oxford studying Paradise Lost, and I was contacted by an alumnus from my university in the US, Brown University, and he said, he was a consultant. He said, I need somebody to travel around Europe and figure out how they take care of their elderly population and write up a report. So I'm like, you have just got the wrong person. I mean, I'm studying epic poems and I'm writing fiction. I was not a journalist. I'd never done a word of journalism. But I ended up taking the job because I didn't have anything better to do. And I spent, you know, a summer going to Swedish nursing homes. And then when I got back to New York and I was writing my novel, which now lives in a desk drawer, and I needed a job, because of that summer job, I was hired by a New York City politician as a healthcare policy analyst. So I spent, you know, a year investigating New York City hospitals, and my reports that I was writing up wound up on the front page of the New York Times. So it turned out I was really good at investigating. I was already a writer, and I'd had this weird summer job. So, you know, basically after that, one thing led to another, and I became a healthcare journalist. But it's always use what you know.
Good advice. I think we should probably leave it there, Catherine.
Okay.
Please do come to our next talk, which is about the US protests at 6 p.m. Maybe we could get a look at your dog before you go, Catherine. Is your dog still there?
Yes, he is. Let's see how we can do this. Okay, Romeo.
Where far out there, Romeo?
Hold on. He's a 187-pound Newfoundland. I don't know if you can see. Can you see him?
We can't. Can we see him? I can't see him so well. Oh yeah, there he is.
Can
Fantastic.
you see him now?
This is Romeo in Cape Cod, just for those people who are curious. That's a 200-pound dog, right?
Yeah.
He's sleeping. Thank you. So we're extraordinarily grateful. That really was a masterclass, which was both educational and political in the best senses of both. So thank you so much, Catherine, and keep in touch.
Thank you. A pleasure to join you all. Good luck to everybody.
It was wonderful. Thanks.
Okay,
Bye.
bye.